All right. So we have an opportunity here for a different kind of conversation. So what we've been hearing from all these great companies and their founders and CEOs is really about the technology, the problems they solve, et cetera. What this conversation is going to focus on, and most of the people on this panel don't know what I'm going to say now.
As if we ever do.
As if you ever do, even after I say it, is to take a look at financing and funding companies in this space. And I want to get your take on where you see opportunities. We've seen a really nice distribution of focus areas. But there's also in healthcare a couple of big trends that are happening that many of these companies kind of fall into. There's a trend of consumer healthcare, right? So for the first time, really putting the individual at the center of healthcare as opposed to the doctor or the hospital. You know, I tell this, you know, the story that, you know, when we were kids, if you got sick, you know, and you had 104 fever, the doctor came to your house, right? And then at some point, because of the convenience to the doctor, it became common wisdom that if you had 104 fever in January in New York, you should go outside and share your germs with everybody else and, you know, and go find the doctor. So it's now being flipped again to put the patient at the center. That's one trend. Another trend, personalized health and the genome and the ability to actually do prevention based on just really better understanding our bodies and how they're individual and at the same time, you know, similar. And then there are trends like convenience. So we've seen telehealth, you know, as one example there. But I guess that in all of these areas, there's tons of activity, but adoption is still small. So kind of just first open-ended question, what is going to be the camel's nose under the tent here that starts to flip this, that we start to see greater momentum of adoption? And clearly, there's a relationship between more companies being funded by folks like you, which is a key ingredient, but you're not going to just do it without having some sense of where these broad trends are going and which are the ones that are, you know, the waves you want to ride. So I'll just open it up, Lisa.
I mean, and to me, it's always about two things. It's about the money and the experience. So on the money side, even though a lot of these things are convenient, patient-centered, and maybe even better, quote unquote, however you define that, if the patient has to pay out of pocket for them and they're not reimbursed by insurance, there's a barrier to adoption. People aren't accustomed in their head to seeking medical care that they have to pay for themselves unless forced by high deductible health plans and things of that nature. I think that's one of the issues, and that's a time issue. Over time, that'll probably change more. And then the second thing is the patient experience. I mean, even though a lot of these things are theoretically more consumer-centric, more available, what have you, they're often the experience of the patient is still pretty lousy. I mean, if you compare it to the experience you might have on Amazon, for instance, it's not that easy to navigate a lot of these programs and companies and do it in a way that connects to all your data and your medical data, your insurance data, whatever it may be. So I think the experience is still very poor in most cases.
Scott, you got a mic?
I got a mic. Yeah, great question. Complicated for us. You know, from my standpoint, we kind of divide the B2B world and the B2C world very differently. And it is about the money in both, but the money's in different places. In the B2B environment...
That's business to business.
Business to business environment. Sorry, no acronyms today. In the business to business environment, we work very closely with a number of very large healthcare providers who are concerned about the cost structures and their huge infrastructures and how they do things in a better, cheaper way. And at the same time, they're sources of funding. So those who are the funders, the insurers, who actually are the payers. and how they can actually more effectively collect their business. There are firms, very large hospital systems, for instance, who are horrible at actually collecting money to make sure they get paid for the services they provide. Patients are very frustrated by it, which leads to kind of the business to consumer side of this, the other side of the equation. And today, I think we're in this great, really exciting space where there are tremendous unmet needs. We saw some of it just earlier today in terms of the companies who presented, in terms of coming up with new innovative business ideas, ways in which they can service patients better, ways in which they can help the large institutions actually provide their services better. But there's huge inefficiency right now in terms of how all of that is actually done, which leads us to look for companies who can provide this better, outsource services better, improve communication, improve the efficiency of it. On the consumer side, one other thought I have is, and this is what we're all kind of waiting for, because you're right, life has changed drastically since we were kids and we're looking for medical service. The killer app hasn't happened yet, and I think we're all kind of desperately still seeking it in terms of consumer service product company, which actually embraces real medical needs that we have in terms of end services, and actually becomes that key differentiator. We have not seen the Google or the Facebook or the Twitter equivalent yet in this space, which is why this is so exciting.
One of the things that, can you hear me? I can take it. So to Lisa's point earlier, when we think about investments in the space, we have two underlying premises. One is, don't expect a consumer to pay, or at least pay anything more, and don't expect them to do anything more. So our view is that as an individual, you want to be more involved with your health. You don't want to be more engaged with your disease. There's a lot of talk in healthcare about consumer engagement. How do we get people more involved with their disease? And frankly, if you have a chronic condition or you have some type of disease, what you're trying to do is find a way to actually be healthier and not spend a lot of time focused on that condition. And there's a whole lot of other things that are going on in your life. You still have a job, you have children or parents to take care of, you have financial concerns. And so to start thinking that you're going to get people to invest a lot of time sitting in front of a computer and doing something with regard to a condition is a really difficult premise. So how do you now do things that allow individuals to go on with their lives, but to provide context to their care? I'm sure many of you have heard of OnStar. It's not a service offered by Toyota, who's exhibiting here, but OnStar, which essentially monitors your automobile, lets you know when you need service, will do software updates remotely, will provide you with guidance. If we can do that for our car, why can't we do that for our health? And yet, when you think about what our car contains today, most standard automobiles in the U.S. contain roughly 70 some odd different sensors that are monitoring different systems. But yet, you all have sensors with you in all likelihood. Your smartphone is a sensor. You might be wearing certain types of sensors. I'm wearing one of the bands that kind of measure different types of things. And so if we can start to gather information in a way that provides context around your health, give you guidance where and when you need it. So, mine might give me an electric shot if I walk into Dunkin' Donuts, if I have high blood sugar, right? And so is there a way to do things? And, one other point in terms of the killer app for healthcare. In many respects today, when you're in Facebook, people are posting a lot of information about their health. HIPAA be damned, right? I mean, they're sharing all kinds of details. They're reaching out to friends and looking for guidance. You wouldn't necessarily think of Uber as a place to go for healthcare, yet in certain cities, now Uber is actually providing for visits. If you need health, one of the experiments they recently did was they'll deliver a doctor to you, as opposed to just being a service that you use and call if you need transportation someplace else. There are some caregivers who are now working with Uber in their market to make sure that you can get there for your appointment, because one of the reasons why, especially seniors, have difficulty coming to their appointments is they lack transportation. And so they're now working with them in ways. So I think there'll be a confluence of events that lead to services that help make it more convenient for consumers, and that's really promising.
So the Uber for healthcare will be Uber?
Could be.
So a couple of things. One, I'll push back on the lack of adoption, because if you look at the 5 companies that did present, right? So in some cases you're talking about millions of downloads, tens of millions of sessions, and these are companies that have really only been around a couple of years. So I think you have to take a look at it from a relative rather than an absolute lens. So is the adoption actually picking up over time? I think the answer is absolutely yes. The other caveat or angle that I would put on what's actually happening is kind of going towards a business to consumer angle, talking about this transition to self-insured employers, where the CEOs and CFOs of large companies are actually starting to make some of these decisions, and they are dangling either carrots or smacking their employees with sticks to change behavior. And that is what it really comes down to, is behavioral change. Anytime you need to change anything the way you're doing it, it's going to take a little bit of effort. And that effort can come either because you're getting incented to do it a certain way, and there's a pot of gold at the end of the rainbow, or you're being told you're going to get penalized if you don't do it a certain way. So I think some of those things in terms of behavioral change and mechanisms for implementing that change are actually coming into play, and we're seeing it with a bunch of our companies.
Casper?
Yeah, so I actually spent a lot of time in Europe, and while I wouldn't promote socialized medicine, I do think what's very interesting is that the average American has 4 physician visits per year. In Europe, it's 9. And I think it's fundamentally a different healthcare system, which is you have much easier access to your GP or your pharmacist. Now, we have fantastic specialist services in the U.S., probably the best cardiac care, best hip replacements and so forth. But it's a fee-for-service environment, and in that environment you can imagine the incentives where your general practitioner only has 10 minutes to see you, right? So that's created an enormous vacuum, first of all, I think, with respect to how and where people get care. And secondly, I think what we've learned from Instagram, from a variety of social apps, people fundamentally respond to peers, their caregivers, their social group. Connected people are much better taken care of, and they are much more responsible, both in terms of their health care and having people watch them. So Fitbit has a great example. I think at 6 months, 5% of users are using a Fitbit. If they've connected to 4 or more people, 30% or 25% of people still using their Fitbit. Same thing with medication adherence. So I think in the U.S., we are addressing this critical consumer need because there's fundamentally poor access to healthcare, to simple healthcare, maintenance healthcare, and it's rather expensive. So we're shifting into people saying, well, I'm just going to pay for it myself. I just had this situation with my kids, said, we're just got a concierge pediatrician. I wouldn't do it for myself, but the fact that he came saved me an emergency room visit. I'm happily going to pay that. And I would do the same thing for my parents if that were available. But we have kind of these intermediate modalities, which is, wow, telemedicine. Wouldn't that be great if I could just call my doctor? And I think you see Kaiser, you see a variety of healthcare systems saying, hey, we're accessible, call us. We're here for customer service and we'll do it at a low price. So that's moving. I think at the same time, we are not as consumers used to paying for our healthcare. So my own threshold right now is, I think, past $200, past a Fitbit or a $50 telemedicine call. It's going to be hard to get consumers to pay for things. But I do think, and so the model that we're all struggling with is probably for bigger amounts of money it needs to be reimbursed, which is a whole battle to show clinical validity and better outcomes. But I absolutely think as long as we're privatizing healthcare, we're giving people high deductible plans, encouraging them to save, that will continue to move where people will spend more and more money. I mean, think about unless you have children that you're going to give your money to, you're probably going to spend your last $50,000 on your healthcare, or you have an advance directive.
But there's a radical change taking place. Not a radical. It's been gradual, but now it's radically taking place. How many people in this room have had some kind of medical ailment where you have not actually gone onto the web to try to find out more about it? Right. So that's a huge change in terms of behavior. We are all there's much more information out there, not necessarily good information. We don't have the ability yet to kind of differentiate between it. But we all have more access to more of it, and something is going to transpire that's going to allow us. There are going to be players out there who are going to actually allow us, who are all trying to take greater control because we have more information and more ability, whether it's, a remote diagnosis in dermatology, which is really fascinating because it means we take more control over. And I don't agree that people don't want to spend the money. I think that we will spend it if we think that there's a direct connection between us spending it. It's a value proposition, and we get a greater return for that. We're at the kind of the forefront of all this starting to change, and I think from an investor standpoint, it's great to see businesses out there that are finally emerging, where they're kind of taking these tools and actually making them more accessible and more relevant, and they're actually tying them to deeper, more critical areas of treatment. That's the change I've seen in the last 2 or 3 years now, where there are companies coming on, and you're right, these are new businesses, and it is the relative transition that we're seeing, which is showing a lot of adoption. Really exciting.
But I would take issue with your premise about the money, because I think, one of the things I thought was really interesting was that the number one category of increase as a result of the passage of Obamacare was the usage of knee replacement surgeries. That's the number one category that grew. So not going to primary care physicians or anything like that. Knee replacement. Now, knee replacement is a voluntary surgery, not a surgery that you generally have to have. You can survive even if your knee might hurt. But that's the category that more people than any other used in greater proportion than prior to Obamacare. So I think people do put off using medical services for economic reasons when they're not insured or they have poor insurance. And I think, the statistics on that are pretty solid, actually. And I think our recent experience just reinforces that. I think really, in the end, while all of these other services are really important and valuable and good and make it easier for people to get things that they may need, if the economic side of that story is not figured out, it won't matter.
So, as investors, and in the particular categories of investment, all of you in early stage young companies, except for Scott looking a little later stage, and I guess Casper, you also look later stage, when you have gazillions. Got to put that money to use. Got to put that money to use. In looking out here, each of you, has summed up your experience, looked at the market, and said, "Here's the theme that I want to invest in because I think that's great opportunity, great need. It's the bundle. It all comes together." What are those areas that you just see of just greatest opportunity? How about you, Lee?
So maybe getting a little bit more granular, because we talked at the high level about this notion of the intelligent, connected health consumer. But areas that we're looking at, in addition to the ones that we've invested in already, which is chronic disease management, starting with diabetes and Livongo Health, or medication adherence like MediSafe, consumer guidance on how to use benefits with Zest Health. But we're starting to look at other areas that we think hold promise. The behavioral health area, tremendous amount of spend. We see an alignment between the consumer, the patient first, with regard to access and how they receive those services, and also the spend that's involved from whether it's the self-insured employer or from a health plan's perspective, where there just needs to be better access to services, but also better management of the cost of that care. I was speaking with a company earlier this week that's involved in one element of that around pain management as well. I mean, tremendous amount of spend. Close to 10% of all spend in healthcare is on pain management. And yet the way in which people get insight into the type of medication, how they're accessing that medication, how it's managed, is an area that holds some promise in terms of being able to provide better consumer support for how you locate, obtain, and then benefit from the use of that type of therapy. So I think those are two areas that we're looking at for a potential future investment, in addition to the areas that we've invested in.
I think chronic disease is totally mismanaged in this country. because we tend to look at our physicians as we do our lawyers or our architects, right? They are really specialists. They are not good at population health. And I think the government has set a clear target of saying 50% of Medicare payments are going to be value-based. So in other words, not just fee-for-service. Don't keep, pulling the one-armed bandit. You need to take care of people, and if you show that you can manage them better, we will pay you for that. So I would say, like Livongo, we invested in Telcare, and the central theory, the philosophy there is, with cheap sensors, can we be fully on people? Can we be more informed about what's going on with them and treat them in the meantime? So as opposed to, if you're a patient with diabetes, you might get to see your GP or your endocrinologist once a year or twice a year, and it's a scramble and you got 20 minutes. That physician has no idea what's going on with you throughout the year. And imagine that you have somebody who's a coach or diabetes educator who kind of sees when you're in control or out of control and says, look, I saw that you were hyperglycemic last week. Why don't we talk about what you're doing? Do you have a cold? Is your insulin dose right? I think that's the answer, and it'll be much less expensive overall. That's the one area. The other one is I think a huge area is the dual eligible population, Medicaid, Medicare. These people are costing anywhere from $2,000 to $5,000 a month. They have completely disjointed care, and it's been shown over and over that having 6 specialists who don't talk to each other is much less effective than one person who says, bring all your drugs to me in a black garbage bag and we'll sort through which ones are interacting with one another. I am the person you're going to call. Do not go to the emergency room. And I think that, again, is something. They're very difficult models, though. In the case of, say, on the diabetes front, who's going to pay for this? Do we go to an at-risk population? Is it the employer that's going to pay for it? Because we're still not at the stage where consumers going to say, I'm happy to pay $50 extra for coaching.
What I find interesting is, some of these things are not necessarily the fanciest technology. No. It's not just the latest, whiz-bang, gizmo. It could be as something like I'm monitoring it, and I give you a phone call. Right.
I think there's tremendous demand. Sorry to go on, but I think if you ask any consumer, would you like this? Absolutely. The question is who pays for it, and that's, I think, the area that we are so stuck in because things are so siloed. Even in a healthcare plan, the fact that your strips are being paid for by the pharmacy benefit, but the service comes out of the hospital benefit, that stuff doesn't work. They don't talk to each other. Yep.
Yeah, from our standpoint, we're highly focused on information as an investor, and in terms of the healthcare space, we're very focused on information as it relates to disease categories and how the data is collected and communicated and how it relates to training. So we actually own a company that's the market leader in training nurses. And so, you have an event like the Ebola outbreak, and that information gets captured. It's happening all over the place. And we actually developed a series of educational modules within days that we actually distributed out to the 2.7 million practicing nurse practitioners in the U.S. and then take that information back and look at kind of patient experience. On the revenue side, it's kind of complicated because we are really interested and think that the data collection and the processing is extremely fractioned and not done efficiently. And on the revenue side of the equation, the stuff that we really don't want to, as patients and people don't really want to focus on and talk about, is there's a tremendous amount of leakage in the medical systems, which all leads to higher cost, poorer experience, et cetera. And we actually have a business that helps hospitals actually more efficiently and effectively interact with patients. So you go into a hospital, you have shoulder surgery, you'll touch 7 different departments from internal medicine, radiology, therapeutics, general medicine, and walk out of there, and anywhere from 3 months to 3 years later, you'll receive bills and not have a clue of what they connect to. And so we actually developed a platform which actually helps the hospital make the patient experience better. So, but this information, we're just tapping the surface in terms of how to use it better for better patient training, changing lifestyle, changing your knowledge base so you know about this service provider that you interact with. And that, that little piece of it's about a $5 billion market in the U.S. today. So that's a major focus of ours.
Well, the good news for entrepreneurs is virtually everything in the American and based on my experience, many parts of the globe, when it comes to healthcare systems, either broken or highly inefficient. And the way it's going to be fixed is by entrepreneurs like you guys in the room. I'll give you an example. So yesterday I was on the phone with Stanford Hospital because I got a bill for $1,556.35, which I had actually already paid 3 months ago. Now, what happened in that case was the organization restructured. So LPCH, Lucille Packard Children's Hospital, got bought out by Stanford Hospital Clinics, which in my mind is one and the same, but obviously two different systems. And so after an hour of bitching and moaning, I still did not get a response. So I finally just sent a letter saying, here's a printout of my online receipt that says I'm going to pay, I've already paid, and there's no way in hell I'm going to pay. Right? So you take simple things in supposedly one of the most technologically advanced parts of the globe, and I am spending an hour talking to a billing specialist at Stanford trying to tell them that I've already paid, for which I have proof. So that's just an example of how screwed up things really are. And so virtually anywhere you look in the entire supply chain, so we've invested in Livongo around chronic disease, we've invested in another company called Wellframe out of MIT Boston area around compliance management using technology. I sit on the board of a company called Retrofit in Chicago, which is actually around behavioral change. And again, I come back to that topic, which is going to be, by the way, a combination of machine learning, which is a deep thesis point of ours, given all the data that's being generated, whether it's through wearables or EMR, EHR. And by the way, the holy grail that we in Silicon Valley sometimes talk about is this notion of clinical and physiological, coalesced data. So your physical activity, your food intake, all of the stuff that you're wearing on your person, plus the Allscripts and Cerners and Epics of the world somehow providing access to the data, your clinical data that resides in that, to then be able to give you personalized care, right? So that's the holy grail. Obviously, there are probably 150 steps, if not thousands, from here to that nirvana. So I think all of those are going to present opportunities. But to Jody's point, I think there's the fundamental systems around payments, having you and I understand our bill, which I still, I've got 2 degrees from MIT, and I'm still scratching my head saying, what the hell is this? What is an adjustment? Right? Obviously, there are some things going on in the background that I'm not aware of, but clearly the system is broken. So again, rather than being very specific, I think I'm just excited about the entire space because it all needs to be fixed and ideally sort of rebuilt almost from scratch.
Well, for me, the category I'm most interested in solutions for, and this is both consumer-facing and health system-facing, is how to reduce medical errors and waste. If you open up your wallet right now and take out your money and take 1/3 of that money and light it on fire, that's what's happening in the healthcare system right now. 1/3 of all the cost, $700 billion, give or take, is literally wasted because it's bad care or it's wrong care. Wrong drug, wrong surgery, unnecessary. I read an article by Tugawandi in the New Yorker, New York Times, New Yorker, one of those, this week. It was about this very topic. It was fascinating. And among the statistics there are that 2/3 of back surgeries are entirely unnecessary and harmful. That probably about half of all of the heart diagnostics that are done are of a similar nature. I myself, found myself in the hospital in January, and as a very informed consumer, probably more than most, since I've worked in this healthcare field for almost 30 years, I sat there and said to doctors who, supposedly are supposed to know more than me, I don't want that test. I know I don't need it. It's not relevant to my situation, and had to fight to not have that. It was stunning to me. And I also got, by the way, a pack of bills that are taller than I am, which I know is not saying much, but believe me, I can't understand them either. I think this whole area, and then there's products like Wiser Care that are directed towards consumers that help them make good choices about what types of procedures and interventions to accept, and products and services like Active Health was, and that the follow-on products now are coming on for physicians to make better choices, and products that actually, in the moment, prevent people from making medical errors at the bedside, or at the surgical suite, et cetera. To me, I think that's a profound area for improvement. It doesn't even take rocket science. It's just fixing mistakes that people make.
One other thing I wanted to add quickly, and Lisa, thank you for triggering the thought, is that one piece of practical advice for all of you who are here is next time you have a visit scheduled with any of your providers, ask to have your diagnostic tests done in advance of the visit. In other words, why in the world would you go to see a doctor, and even if it's just a simple blood test, and you go there and it's like the doctor is taking a divining rod and they're supposed to say, well, here's what I think is wrong with you, when they don't have the data. And so if you go and have the test first, because what happens in most cases is you see the doctor orders tests, and then somehow, some weeks later, now you might even be able to see the tests online, but you don't know what they mean, and you're sending messages back to the doctor saying, hey, this shows out of range, am I okay? Right? Have the test done in advance, and then you're in a position to talk to doctors about it ahead of time. I mean, what frustrates me more than anything else is that so much of medicine today is still where we as consumers are guinea pigs. We're the petri dish. Well, try this. If this doesn't work, then I have a second-line therapy and a third-line therapy. But, if you were a chemist or if you're working at MIT, like what they do in a laboratory is they know enough about you from whether it's through your blood or through your genotype or through your biome, which is basically a sample of fluid from your gut, and they should be able to tell you what medications will work based on having data. And yet, we don't do that yet today, and we'll get there, but it's going to take some time.
So with that, you just heard practical advice from a venture capitalist.
No, it may never happen again.
And with that, we have to bring this panel to a close. Thank you very much.
I would ask that people stay in the room. I know we're going to reset the stage, but if people wouldn't mind staying, then we can get going faster because we have the next 5 companies coming up, and you can mingle amongst yourselves.